connected? Hello? Can you hear me? We are testing the audio out.
We got it.
Well, I guess we were talking to no one for a while. Hello, everyone. We are going to be talking about knee parts that hurt, how to diagnose and treat knee parts. That's very specific.
Yeah, that's real professional, Mike. I think we'll call them knee structures, anatomy of the knee, what causes pain and how you can relax the tension, get the pressure off the parts that do not want pressure and get the parts that need pressure to work properly. How was that for a little analogy?
Oh, they can all hear us now. That's good because we're talking for 2 minutes to no one.
Yeah, let us know where you're from. You know, name and town location would be nice.
So we're going to go over a bunch of different areas of the knee and how to test if that's what's causing your pain, and then hopefully give you some stretches or exercises to try to see if it helps. And we'll take some questions, and yeah, you can let us know where you're from, but where's my mouse?
Yeah, relationship coach.
Inner knee pain for the last month. Well, we will be going over inner knee pain. Hopefully it doesn't last another month.
Yeah. That's
Diagnosis osteoarthritis of the left knee. Grateful for everything you say. Well, good.
Good.
Bob and Mike. Well, that's Brad, but we could pretend you're Bob. Bob's here.
Oh, I thought that was Boob. Boob. I guess it's Bob. Sorry. Well, you know, it's the way you spelt it.
That's Coach Ben. Oh, he's here a lot. He's in Spain.
Oh really? Yeah.
Wonder what time it is in Spain.
Well,
please touch on bone. We will. Well,
yeah, I think
talk about a little bit.
Yeah, we can talk about a little distraction technique for that. That would give it some.
La Crescenta, California, West Virginia. We have Skip Lam. We have Central Illinois. Joe is from there. We got Laney from St. Petersburg,
Did you mention
Florida.
West Virginia?
I didn't. Yeah, I did, but I didn't say that's Skip. Hi, Skip. We got Tom from Kelowna, British Columbia.
There you go.
Is that BC, I'm guessing.
Mm-hmm.
Joanne from Massachusetts.
What a pleasure to have all these people here to listen. I hope we can help you out.
Yeah. Hello, Ellen. Hello, Jamie. Oh, from rainy Wichita.
We've only got 30 seconds, Mike. So, yeah, whatever. It's a nice day here. It's going to be very nice little storm roll.
Can I go through all these names in 30 seconds?
Well, no, you really can't, Mike.
We got Jeanne, Kimberly, Diane, Matthew, Patty, Matthew again, Sandra, Terry. Oh, they're just coming in like wildfire now. Diane. Lynn from Iowa.
I love Iowa. It's a nice state right below Minnesota.
It is right below Minnesota. Mm-hmm. I don't talk like that, but
yeah.
Intro song's coming. We better be quiet.
Oh, here we go.
Bob and Brad, the two most famous physical therapists on the internet.
And they can hear us right now. You're talking over the intro song.
Was doing a dance.
Our camera guy's dancing, but unfortunately it was not on camera.
No, there we welcome. Here we go. Over on this camera.
Over on that camera.
And now up that one. No. TikTok is going. All right, we got TikTok going and everyone else. So very good. Should we get right to it, Mike, or you want to talk about the weather?
Yes, just a friendly reminder. You can rewind the video if we say something and you miss it, or skip forward if you're back. So you can move around this while it's live.
That's right. And then we're going to put it on the YouTube channel. You can go to the live and look at history.
And Facebook.
Yeah, as a matter of fact. So even the previous ones, if you have questions on subjects already talked about. All right. So the knee, like I mentioned, is a simple hinge joint. It just goes straight and bends about 140 or 50 degrees, depending on the person. So that makes it a relatively simple joint. It's got a kneecap, which is also, there's some more joints under that, which complicates things a little bit. 4 primary ligaments. And then we also have the meniscus and the hyaline cartilage. People with arthritis, we're going to talk about that. A little bit about the ligaments, and then some strained muscles and tendons that connect. All in all, We're going to cover everything if we have time. We're going to answer questions. Mike, I'm babbling now.
You are a little bit. So I think we'll get into the first one, which is commonly known as the kneecap. And people can often have patella femoral pain here. All that means is patella is the kneecap, femoral is for femur, which is your big bone right here. And oftentimes people are having some type of tracking issues with that, or it's wearing out.
Right. So if we look at Sam's knee, we have no muscle here, but this is a tendon that connects all the quad muscles to here, and underneath there is our kneecap, and then the condyles here marked in red are there. So what happens is the patella needs to track on these condyles evenly. Sometimes it'll go over to one side or the other. It can cause pain, and there's a couple of things we can do with stretches and exercise. So there we're talking about the patella. What's the first thing we're going to address, Mike?
So the first thing we want to talk about is when it comes to the patella being problematic, something you want to actually avoid is what we call in the therapy world long arc quads, or kicking out. So if I'm just sitting here and I'm kicking my leg out straight and then back down, this is a fine knee strengthening exercise for most people. However, if you're having a lot of pain here, this just puts a lot of increased tension and pressure right on that kneecap region. So it's something you want to avoid for a while. And you also don't want to get too far into a squat. So when you're bending down, oftentimes people will notice they're fine. Oh, it hurts. And then it's problematic. And they might actually shift their weight off of that knee. So just avoid overstretching or straightening the knee for a little while it's causing some pain, because it can put more tension on the kneecap itself.
Yeah, I do want to mention with these long arc quads or kicks are something that's non-weight bearing. And actually we have promoted this in certain situations, but if you're going to put ankle weights around the ankle, or go on the machine that's called, for the quadriceps, that really can put more stress on the bottom side of that kneecap. So that's why when you get that stress on there, you got pain already being irritated by more weight. So, are we going to talk about a little distraction with this? That could be a really good thing, but maybe not yet. We can get into that when it comes more to the joint.
So we're going to actually look at some other areas you can you can strengthen to help this issue. So an important thing to do is just look at your hip flexibility as well, because oftentimes if people have tight hip muscles, it can relate directly to the knee itself. So we want to stretch out some of the hip muscles. So a good quick testing you can do on your own is when you're sitting down, first see if your knee can go in and out okay, if it's got full motion. Some people, one side might be tighter than the other. Just try to look for some inconsistencies with the painful side there. You can also see how far you can flex or extend your knee. You can do this many different ways. I should say flex and extend your hip. I'm talking about hip and knee at the same time here. You can do something we call a Thomas test to see if you have tight hip flexors. You can lay on the edge of something firm if you're able to. This can be a bed, countertop, table, whatever, and you're just going to drop one leg off and then see how far it can go down. You want to try to get even with the mat or down a little bit. If you're way up here, you're going to be tight, and try to bend that knee, and then just compare sides, see if one side may be tight. And you can also check your knee flexion, basically how far up one knee and hip can go compared to the other side, just to see if you have some limitations there.
Right. The idea is be consistent when you pull this knee up on one side to the other. It's best to have another person with you to look at how far your knee is going down, because while you're lying there looking up at the ceiling, it's not easy, but you will likely feel the side that is tighter, and then say, oh yeah, that's definitely tighter. I need to stretch that out some more. And that is going to affect how the mechanics of the knee work. And that's why everything is connected. So we don't just look at the knee. We got to look at the joints above as well.
Some other things to look at is if you have a different type of walking pattern, that can really affect some people's knees. So some people have what we call a Trendelenburg gait. So they may actually kind of waddle walk like this. I don't know what else you call this. What was that other name someone said last week?
Oh, the Charlie Chaplin.
The Charlie Chaplin walk.
Yeah, that lateral right to left motion. And usually it's on one side. It's very significantly. So if you lean to the right, you have a tendency to go that means your right hip is weak. So you want to strengthen that muscle. Am I right? Did I get that right?
Well, your left one actually keeps you upright too, so I suppose it depends on which way is weak. But sometimes, basically, these hip abductor muscles keep you upright. If one is weak, you're going to kind of sway like this. So a good idea is to strengthen that. There's lots of ways we can do that.
Yeah. Well, I think one of the easiest ways is, depending on the individual, you start out, if this is the weak side, and you'll know, you'll do one leg and then do the other one. And say you can do 10 very easily on this side, and you get the 4 or 5 on this one and starting to get fatigued, you know which one is weaker as well. But the important thing is you don't do this. I'm strengthening this muscle. We want to isolate that muscle. And oftentimes, particularly if you're younger or you're really active, you may need to put a weight around your ankle, or I personally like just to use a band like this. Works better with shoes on. I'm going to demonstrate it without shoes. And it still works, but I'll show you the problem. So we're going like this. And plus you're working some balance. What happens is the band can slip off your foot if you don't have your shoe on. But you're going to go 10 to 15 repetitions to strengthen that hip with good gait. And the other thing with Trendelenburg is some people aren't even aware that they're doing this. So look at a full-length mirror if you got a hallway at home and look at your gait. In other words, see if you're doing that and then stop doing that, and you're going to feel the difference. And that can also help eliminate that waddle walk.
Now, another thing, what we want to talk about for many different knee pain issues, including patellofemoral pain or kneecap pain, like we're talking about, is when you stand. A lot of people like to stand and they straighten their knees and they lock out. I actually hyperextend, so my knees go past 0 degrees. And this is going to put a lot more pressure on the knee joint itself. It's going to put more pressure on the kneecap. So what you want to do is think about standing with a soft or a bent knee. It's just this little bit of motion difference, but standing like this for however long you have to stand at your job or whatever you're doing is going to put a lot more pressure on your knees. So just have them relax. This puts the pressure on the muscles instead of the joint itself. You may notice early on you might get a little fatigued after a while, so it's okay to kind of stagger your stance up if that's the case, or prop one foot up, but just try not to keep your knees locked out. If you have a really bad habit of doing this subconsciously, what you can kind of do is put a piece of tape behind your knee right here, which Brad will grab here quick.
Wow, absolutely. I think for this, using a piece of this kinesio tape, it's stretchy. You can buy it all over. And there we go. We're going to put it right on the back. Right here.
So I have a bent knee while I'm doing this, and he's going to put it on nice and tight.
I'm going to stretch it. You see it stretches. I'm going to go all the way down, get it off, and this always has problems when I'm doing it in front of the camera. Anyway, there we go. We got a little stretch on it. So when he straightens his knee,
it pulls on the skin behind my knee, and I remember, oh, my knee's locked. I need to relax it. So that's something you can try. If you're sensitive to certain tapes, only wear it for so long a day. Take it off. Make sure you don't get any type of rashes. But that's something you can do for a couple days. This can also be something you can use when walking, if you happen to fully extend your leg out when walking, but we'll get into that a little bit later. So I'll just leave the tape on.
There you go. There's another kneecap specific treatment for kneecap. It's called McConnell taping. It's from a therapist. Her name was McConnell. And we're not going to show that one because that one uses rigid tape. It's a special tape, and it takes a little more skill on taping the kneecap. Typically, you'll pull it over medially. What I am going to show you a simple little range of motion and mobilization you can do to your kneecap. And what you'll do is sit, just like I am here in a shorter chair, let your knee out, completely relax the quadriceps, and then see how your kneecap is moving right to left. It should be able to move quite a bit, actually. First time I ever did this, I never knew my kneecap moved like this, up and down as well. You can diagonal move it and just check it from one side to the other. And you may find the painful side does not move as well as the unpainful side. So you can stretch it. Don't get aggressive with it right away, but work it. And you may find once you get things moving a little bit, it loosens up. Pain starts to decrease, and then you can do that. You're not going to really work and push it. should not be no sharp pain, little stretch pain is all. Easy to do, and you can check it on yourself. So
just make sure your muscles are relaxed like Brad was. If your knee's
Ugh.
bent like this, your kneecap's not going to move. It has a lot of tension on it. So your knee has to be straight and then relaxed, and then it will often move pretty easily.
there you go.
A lot of people go, ew, the first time you do it to them.
Yeah. If I'm like this and I put a little bit of quad tension, it locks up, even a little bit. So that's just you learn how to relax your muscles, get in tune with your body.
Now, the next part we want to talk about is pain perhaps on the outside of your knee. So what this can be is your IT band. So if you actually look at my leg here, you can see my IT band right here connecting down. So if you're having pain more lateral aspect, that could be what is causing it. If I'm bent here, you can't see it as much. Once I extend, you can see right there.
But wait, Mike.
What?
We've got an actual clip from Bob and I.
I know. That's what I was going to get to.
That? This shows the anatomy very clearly. I actually use duct tape as a model on this.
Wow, high
Danny,
tech.
is it ready to go? Okay, Danny's going to pull us up, and we're off to memory lane and showing a really good IT band exercise and anatomy.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We're the most famous physical therapists on the internet.
In our opinion, of course,
Booyah.
Bob. Booyah!
Today we're going to talk about new IT band stretch/massage that works. Stop knee pain. A lot of people don't realize that something that starts way up here in the hip can actually cause knee pain.
Right. But Bob, it was new IT band stretch and massage that works.
Didn't I say it right?
Well, you didn't put the pause in there.
Oh.
Pause, stop knee pain. Yeah. Carry on, Bob. Bob, this actually was a request from one of our viewers, made a comment. He said, let's update our IT band. We haven't done it. So I did a little research on it, and this is what we came up with.
All right, let's go. Let's go to work.
All right, let's, Sam is involved.
Oh, sure. That's what we're going to do over the anatomy first.
Yep, exactly. A little A and P. Well, at least the anatomy portion. So here we have
physiology, if you're wondering out there what the P was.
Yeah, we're not going to do any physiology. But if you look at the anatomy of the IT band, it actually connects up to the iliac crest up here, and our duct tape represents the IT band. And that's a good, because the IT band is very stout.
Tough, fibrous stuff, yeah.
Just like duct tape.
Yeah, and it really doesn't probably stretch that well. It's probably more the muscles that attach into it that stretch more than anything.
Good point, Bob.
So,
and so that's why we have in blue, this represents the tensor fascia lata, TFL, and that connects in this, and the fibers run this direction, connecting up to the IT band. And don't forget the glute maximus. Now, it's not a full connection, but it's partial connection to the IT band as well. So we want to get after those muscles, and they will be easily and more pliable to work with than the IT band. But we're going to work on the IT band as well.
Sure.
But don't forget this. It connects down across the knee joint to Gerdy's tubercle, which is on your tibia, a little plateau there. But that's not so important. There's actually a bursa under there.
A bursa is a fluid-filled sac, and that can get irritated if this band is tight.
There happens to be a number of nerve endings in your bursas. You have bursas all over your body, working as lubrication.
All by the joints.
Okay, now we are back, Brad, and we're going to get into the stretch now. So, Danny, can you pull up that clip for us, please?
Oh,
that's what I was alluding to, Brad.
Oh, yeah. No, this stretch has been a real helpful, and I think this is worth anybody that has IT band pain at the knee because it's so simple to do.
Let's roll.
Okay.
And I'm going to go right to that stretch that Dan did because it really did the trick.
This was kind of an amazing story because Dan was to the point where he couldn't even hardly walk anymore.
Right.
Was going to give up doing triathlons.
Right. His biking and running were both suffering severely.
Both shot.
Yep.
And all he did is this one stretch.
Yep. He would cross over like this, grab this knee, and then pull. And you can see how the white lines on my pants, represent that IT band. And I'm pulling and stretching that. And just like that. Now you can do it on the floor. You can do it, sitting down. And you're just going to hold that for 30 seconds, 3 times. And he said it wasn't the first couple of days. After a couple of weeks, he said his knee pain was gone. That was about 15 or 20 years ago.
Yeah.
And he does Ironman triathlons now. As a matter of fact, he's training for one right now.
Yeah, and he's in his 60s.
Yeah,
I mean,
yeah,
that's
he is.
just amazing.
Yeah.
Really, really.
And we're back again.
Oh, yes. Okay, here we go. So that stretch is a real true story. I still know him. He's still running and biking without knee pain. So go ahead, try that stretch. Very simple to do. The other thing is we did mention in there the 6-inch foam roller. You don't need to have the long one like this, although it's good for other things, but probably one that's a little soft, the density of it. You'll put it on the ground, and right here, this represents, this stripes actually is the same location as your IT band from the knee to the hip. And we're going to actually roll right on that.
And you take pressure off of it by using your other leg. So Brad's not putting all his weight directly on it, because it gets pretty intense for most people.
Exactly. And you probably find the tender spot and you kind of work that or work around it. And the important thing is not just on the IT band, but if you remember the anatomy, there's two muscles up high that connect to the pelvis. So it's above the hip, and it feels different there, feels typically a little bit better, but you want to get those muscles, the glute max, the posterior fibers, which are on the back side of the butt, or right here, right where your pocket is. So you got to lean forward a little bit and work that one as well. And then you can go back to the IT band. You can see I'm really using my hand here in this foot to unweight so I don't get too much pressure. And it's working nice. I don't have IT problems, but this feels like a good stretch, I should say. Oh, I'm getting tired.
Well, you are. Should we answer we did have a question, someone referring to going down steps caused knee pain, and that's the only time they had pain. So what is probably happening with Mary's question. So oftentimes when you go down steps, what happens is as you're going down, your knee, let me wait for the camera to catch up. There we go. My knee is starting to go over my toe. This leg is holding you up, and that's probably where you're experiencing your pain. So if you're having a lot of pain and your leg's almost buckling on you, what you can try to do is do more of an angle step down, or you can work on just using the good leg. So you go up with the good and down with the bad. So if, say, your left leg's your bad leg, you would use your good leg to descend down and go that way, because all that strain is going on your good knee. Now, if both your knees hurt, Mary, you probably lack just getting comfortable with your knees going over your toes. You can kind of get slowly acclimated to this by just stretching and just slowly going what is pain-free, comfortable, getting used to your knee going over your toes. This is kind of what Ben Patrick did for all his knee pain issues.
Right. And, if it is real painful, it's on one knee, like Mike was saying, you're going to go down one step at a time.
Yeah.
Always leading with the sore knee. That way you don't continue to irritate it and get the inflammation worse.
If it could also be arthritis, but I mean, it probably hurt doing other things besides stairs.
I do want to mention there was one thing that I've had a lot of success with people going downstairs. That is the kneecap misalignment. And that's where that McConnell taping has really been helpful, where you actually tape the kneecap over one direction. You put it on, go down the steps. And I've had people with pain going down at about 8 or 9 over 10, put the tape on, and the pain doesn't go 100% away, but very much less. I'm going to recommend you to go see our video, Knee Pain McConnell Taping, Bob and Brad, because we don't have time to go through all the details of that particular taping. But any therapist, I should say, well, I would say most any therapist is familiar with McConnell taping. So that could be another option.
Jeanne was wondering where we got the roller. So you can find foam rollers anywhere. That one is a OPTP roller. You can find them on Amazon or their website. All our foam rollers here are OPTP. That's what is that, a medium density one?
Yeah, this is medium density OPTP. They have good quality equipment. That's why we like it there. And again, there's low density, medium, and then the harder density, which is the black color one.
There's a really soft one, but that may not do a whole lot for IT band.
Yeah, the medium one most people will be comfortable with. This is a soft one, and you can see it's just really squishy. Probably not what you want.
So what we want to talk about next is patellar tendon pain.
Ooh.
So we talked about the patella, which is the kneecap itself, and the pain is usually somewhere on the kneecap bone self area. I'm saying it's self a lot here. So, but some people have pain just above it, kind of in the tendon area, or they can have pain just below. So this is called infrapatellar tendon pain, and this is called suprapatellar tendon pain, meaning above or below. So people can get just tender in an area. This can be caused by lots of different issues. Some people call this runner's knee.
Yeah, it's typically from repetitive motion, running, walking a lot, maybe going up and down stairs a lot. It could be some trauma if you fell on your knee, maybe to get it going. One way or another, the treatment, oftentimes the same treatment will treat all of them. What were we going to talk about?
So there's a lot of different strengthening exercises you can do, but oftentimes we just need to get some blood flow to the area. So what we're going to talk about is cross fiber friction massage. So what you can do is just take your hands. You can certainly use a massage gun or other tools you may have available to you as well. But you're going to go, the tendon runs this way, like we had on Sam earlier. And then so we're going to go the opposite direction. Normally, if I'm doing it myself, I like my thumbs because it's easier to go that direction. It's kind of awkward with your fingers. And you're just going to go kind of press hard. And if it's really tender, you're going to feel it. You're going to do this for about 30 seconds to 2 minutes and just kind of rub in that area. Now, if your pain is down here below the kneecap instead of on top, you can do it down there instead. But your thumbs may get tired, so you can certainly use any type of tools you have available to you.
And I do want to mention, if you're doing this deep cross friction massage and it's painful when you start, and after about 15-30 seconds it's still painful and not getting any better, it's too early for it. Get yourself a cold pack, a gel cold pack, especially on the knee, that conforms over the knee, and leave it on there for 15 or 20 minutes. I do that 3 times a day. Give it a chance to cool down. Maybe use some ibuprofen if you tolerate that, and that will help. Then you can go to the massage after it's not all flared up. I did want to, what?
Go ahead. I'll answer it later.
If you do use a massage gun, get the round head. Okay. So, and you're not going to go straight in on it. And I was going to just beat it up. Oh, excuse me, Mike. Turn it sideways with a round head. And that actually gives a nice cross friction massage, just like I'm doing here. It works quite well. You have to have a massage gun that reciprocates back and forth. Probably 6 to 8 millimeters at minimum. 10 millimeters would be okay. They'll say that's the amplitude. I call it the travel. And this is what Bob, he had suprapatellar tendonitis. This is a few years ago. Couldn't get rid of it. He was doing his cross friction massage with his fingers, getting sore fingers, just not enough. And he went like this on his knee, and really worked it. And he said it took care of the problem within a couple of days, because he worked it a little bit longer, probably not more than 5 minutes as a rule. Big thing to be careful of. Don't get the massage head onto your kneecap. It's going to hurt, and it's not going to help anything.
Or just bounces.
Yeah. So
mine's bouncing.
Keep it like that. You can use, like, you've got an airhead on that one, right?
No, I have a round head on my airhead's over here. You can use an airhead too.
If there are airheads, at least on all the Bob and Brad ones, and they're soft. Now, them, you can get close to the bone. It's not going to hurt. And it's one of those things that's where they're nice to use, when you're getting close to the bone.
I do want to mention, try doing different angles with your knee. So try it with your knee bent. Try it with your knee straight or relaxed. Brad's got a stool there. I would have it propped up, and see where you feel most attention, and just kind of work that area. You can do the same thing on the infrapatellar. Geez, there's a lot of words.
Infra is below, Mike.
Yeah, infra.
Supra above.
There you go.
All right. Let's go on. These people are getting bored of watching us having fun with the massage gun. So there we go.
The next condition we are going to talk about is arthritis.
Let's get Sam over here.
Which is very common. So arthritis typically affects the bones of the femur and the tibia, and you're having a lot of wear and tear, for lack of a better term, in your knee joint itself.
Right. So let's look at the knee. Now, typically arthritis, for most commonly, is people probably in their 50s or older, 60s and 70s, even more prevalent. So if we look at the knee, get the kneecap out of the way, there's cartilage, nice, smooth, shiny, healthy cartilage here, as well as down here. That becomes, actually, it looks kind of like pitted or rusty. it's not very healthy looking if you've ever seen it when it has severe arthritis. It's kind of like sandpaper and they're grinding against each other. And that's why when you walk and put weight on it, it's typically much worse as opposed to non-weight bearing, or like if you're in the pool. The other cartilage that gets involved, if you look here, can you see that, Tanner? These two rings, that cartilage has got a different job for the knee. That supports and stabilizes the joint. But this can actually rip, it can tear, it can fold, and it can actually have a problem where the knee locks up. And I personally, with my patients, they say it's very common going up or downstairs where the knee locks. And then they kind of move it around a little bit, sit down, get the weight off of it, and in a little bit, it feels better. Then they can get up and walk again. Probably have a meniscus tear or fold, something of that nature. And those can be treated. And we're not going to get into the details of that. You need to see one of our videos on meniscus exercises or treatment.
Now, if you're having a lot of arthritic pain, oftentimes movement is still good for your knees because this promotes synovial fluid, which is in every joint, and it happens more often when you get movement going. So just doing some exercises or walking or biking. So say if walking is very hard, or maybe you run, but running's hard now, doing some non-impact type activity can be beneficial. So swimming, biking, there's a couple other things. What are
like
ones?
the ellipticals? You mentioned that.
Yeah.
They don't have the
impact forces.
Impact, particularly with a straight locked knee, like when people walk on with a heel strike. You didn't talk about that yet, did
we
you?
didn't talk about walking patterns yet.
Yeah,
no.
That can make a big difference when you have that arthritic knee pain. So is that a good thing to go into next, Mike?
We could talk about walking patterns because this affects most knee pain issues, just looking at your walking gait and seeing how that goes. So with most people, when they walk, they typically put their foot out in front of them, they heel strike, they are not engaging a lot of their muscles. This is putting a lot of impact forces on your joints. So it starts at my ankle, and then it goes up to my knee, and then I'll go into my hip, and then my back. Now, you may not notice a lot of pain when you're walking initially, but you do 10,000 steps every day. That's going to add up to, I don't know how many steps in a year because I don't want to do all that math right now.
I'll get the calculator out.
Anyway, so what you want to do instead is just walk with a soft bent knee. Your step is not going to be as far forward out in front of you. It's going to be a lot closer to your body. And your body should naturally shift over your knee. Watch when I'm walking, my body is over top of my knee. My leg isn't in front of my body. And then I have to roll through like this. So you're going to take shorter steps, have a nice soft bent knee, and try this at home first because most people's shoes have higher heels than their forefoot, unless you buy zero drop shoes like I have here. So try it barefoot first and see if you notice a difference with your knee pain, whatever it may be.
Yeah, if you're barefoot, you will feel that heel strike. Everything, the impact forces on a heel strike are much higher than when you go with your forefoot. So locked knee is what's happening. Heel is up and bang, the force goes through the knee, the hip, and the back. You'll notice this right away if you're walking barefoot on a hard floor or a concrete. Like I go to my driveway barefoot and I'll 4-foot walk, and it's clearly a big decrease in impact to my joints versus coming down in that heel. And you'll experience that as well.
I would say if you're struggling to understand this initially, march in place. You're not going to heel strike in place. This is very awkward. You're going to walk normal in place and then just go forward. Same concept.
Yeah.
But yeah.
The biggest thing that I think most people don't understand, including myself prior to the PT education, is when people walk and they're walking faster, they think about, I got to take a longer stride, and you're going to go faster. Everything is going to go better with a long stride, but that actually puts more impact. So the stride length is actually shorter, and you go a little faster cadence, if you will, but we have less impact through the joints.
The next condition is one most people know, but it typically just affects adolescents, and that's Osgood-Schlatter's
That's
disease.
even a tough one to pronounce.
So this normally just goes away with time. Oftentimes you have a big growth spurt is when it happens. So that's why it's normally in your teenage years. Oftentimes your body's just not acclimated to that big of a growth spurt. So it can affect some of the tendons, ligaments, bones, kind of everything all at once.
Oftentimes this is the location where the infra patellar tendon connects to the tibia, and you actually be a pretty prominent bump there. It can be, and it can be real uncomfortable, particularly if you go on your knees on a hard floor. It's painful. So there is pain associated with it. There is not any, well, not that we know,
specific guidelines or treatments for it.
right?
Just don't do things that flare it up, essentially.
Right. And it, in the majority of cases, it goes away with time and age.
We did have a question about. We had a couple questions actually I wanted to look at. So,
let's think.
Carla says, when I extend my knee, it feels like a rubber band is getting hung over the kneecap, which is now causing pain.
That's interesting, Carla. Yeah, I would actually, first thing I would look at is this. We talked about this earlier, and look at the mobility of the kneecap with completely relaxed quads, and go one side to the other, as we mentioned earlier in this video, and see what happens with that. If you've got something that has tightened up, and maybe something as simple as mobilization of the kneecap would help break that up. Maybe there was an injury there, maybe some scar tissue possibly.
Yeah, and also check if your kneecap is tracking right when you do that, because if you notice it's way off to the outside or the inside, you could have some type of patella tracking. But it sounds like it's kind of up here, and then it kind of snaps on her.
Yeah, it's kind of hard to say over the video, and the patellar tracking is really hard for the layperson to understand. You actually have to look at a lot of knees, at least in my opinion, to get a good feel for that. So I don't know what else we can say about that.
Skip says, I have shin splints with knee pain. What would be your suggestions? Well, the walking changes we just talked about, Skip, would be a really good thing. If you missed it, just rewind the video. You can do that live, and it'll stay on once the live is done. You can rewatch as many times as you want, but just look at how we talked about walking with a bent knee. That could help. For shin splints, if you're really struggling, decrease the amount of walking or running you're doing. And also, shin splints are your tibialis anterior muscle, so it's typically this area you experience that. So strengthening this muscle can be good. To do that without having to get any fancy equipment, you'd go to a wall, but our wall space is kind of covered there. The further out your feet are, the harder it's going to be, the closer, the easier. And you just work on bringing your toes up and then back down. This is going to strengthen that tibialis anterior. I personally like to do a lot of volume with this. I'll do 25 reps 2 times because it's easy for me. If it's hard for you, just start with 10 reps. Do it 2 to 3 times a day, and then do it every other day and try to strengthen up those tibialis anterior muscles.
We do have a video dedicated on shin splints. Bob and Brad shin splints, and there will be some more details on that as well.
Yeah, because calf strengthening is important, and you can actually stretch both ways with your ankle as well.
Right.
So.
All right. So what we want to talk about, medial and lateral joint pain.
Yeah.
We got another question.
Well, let's talk about medial and lateral joint pain, and I'll look at the questions.
Okay, so medial lateral is, let's expose my leg a little bit here. I got these nice socks. Anybody notice that? No one commented on them. Anyways, medial is on the inside, lateral is the outside. So you have pain here or here. We've already talked about lateral knee pain with IT band early on. That can be one reason. It's a common reason for pain on the outside. You could have a ligament problem, which is the LCL, lateral collateral ligament, which connects the 2 bones right here. And that, if you've had an injury, that's usually from some trauma. Maybe you fell down, something happened where it stretched it. Same here. There's a ligament that it's the MCL, which is right here. They do similar jobs, just one kind of corrects one side, one stabilizes the other direction. One thing on this side, if something comes on, you had no fall, nothing to stretch either side or irritate it, but on the inside, all of a sudden, out of nowhere, you're feeling pain, and that could be, this is a mouthful too, the pes anserine. Am I pronouncing that right?
I say anserine, but anserine, I don't know who's
right.
It depends on the accent.
I was going to look that up and see where that word came from, but whatever, it is a right here where the ligament comes over, the tendon comes over, there is a bursa. So you have bursas all over your body. They're little fluid-filled sacs, and they lubricate a tendon or a ligament that rubs over the top of a bone. It allows that to happen without irritation, but that can get irritated for whatever reason. The bursa gets inflamed, and then you have pain associated with it. So what are we going to do about that?
Well, with that area, oftentimes you can do some massaging, possibly some ice, or just checking your mobility. Again, sometimes people with pain in that area oftentimes have tight inner thigh muscles. So a simple stretch you could do is lie down on your back and do a clamshell.
There you go.
So if I'm laying like this, to test this out, just bend both knees if you're able to, and then you can just let the one side drop off to the side like this, and this is going to stretch the inner thigh region and see if that is tight. Oftentimes people have tightness in their hip, which is affecting their knee and how it works. So you may not be feeling the pain in your hip, but that muscle tightness is what's causing your pain down in your knee.
Yeah, and if it is real painful again, and this irritation is just really flared up, again, you go back to the cold pack and ibuprofen if that works for you, and work with that 2 to 3 times per day. I think this is one of those things where if you're doing a lateral motion like ice skating or cross-country skiing, where you're doing a lot of lateral motion, that could be involved there with that. The big thing is if you find an activity that specifically irritates it, that's the one you need to stop. You're not going to work your way through it and think that I'm just going to work harder and it'll go away. You need to back off of that and work some other activities that don't irritate it, but strengthen the muscles around it.
We had some other questions kind of relating to weak legs and knees. So Alicia says, what's the easiest way to get off the couch? I have bone on bone.
Ooh.
Unfortunately, we can't really fix the bone on bone part, but just using your arms obviously to help, which I'm sure you already are, but using your arms to help push up, checking the height of your couch. So obviously the lower the couch is to the ground. So if I had this stool, Brad's in, you can see how much harder it's going to be to leverage up from a lower surface compared to a higher surface. So either sit on a higher surface, or if you can sit on a pillow or a firm pad on your couch as well. Or possibly even I don't know if they make lifters for couches. They do beds, but do they for couches?
Yeah, I don't know. I think
might get kind of tippy.
Right. One thing I want to mention, I've done this with patients. So this is where I talked before. This might be one of the situations where you could, before you stand up, is just start moving your knees back and forth. We're not doing a full long arc quad where you're working those muscles hard, but we're trying to get some movement, non-weight bearing in the joint, so the synovial fluid kind of gets worked in, and do both legs. And so I'm going to be 5 to 10 repetitions. Just try that once before you get up and see if that helps. If it does help, you're going to want to continue to do that throughout, when you're sitting down. Anytime you sit down for any length of time, you can just do that even before you get up, maybe halfway through the movie or whatever, or well,
movie.
Well, I don't sit on the
Maybe
couch.
she's reading. Anyway.
Well, actually, I've been reading a book myself on the couch.
Good. Yeah. I listen to audiobooks. Anyway, Carl says, I have pain at the back of my knee and very tight calves and hamstrings. Are they related? Yes, they are related, because if we look at the knee here on Sam, unfortunately,
are we going to talk about the popliteus?
We will talk about the popliteus too. But if you look at the back of the knee, you have hamstrings connecting from the back region here, called your ischial tuberosity. You have 3 of them connecting to your knee. And then your calf muscles, you have 2 different ones, and they run from way down here and connect to your knee. So if you're tight there and you're tight there, all the force is going on your knee.
And actually, those hamstrings cross the knee because they're flexing, they're moving down here.
Yeah.
And then the little popliteus muscle, it's just a small muscle right here, but it's really important for knee mechanics when you walk, and that muscle can get painful and tight. So they want to know what to do about it, I think.
So stretching your calves and hamstrings are something you're going to want to do. There's lots of ways to do it. We can just show you a couple basic ones. A hamstring stretch, you can long sit, you can sit on the edge of something, you can stand. I think most people feel pretty comfortable doing it on the step.
I think that is, if you're mobile, you have reasonably good balance, and a handrail, that's a great way to stretch.
So just put your foot on a step. The lower the step, the easier it's going to be. When you want to get, I'm just going to move that question out of the way because it's kind of blocking the screen at the moment. There we go. And I'm going to lean forward and I feel a stretch back here. If you want to get more aggressive, just go higher up. The nice thing about doing them at the stairs is you can hold on to the rails for support. You're going to do 30 seconds, 2 to 3 sets, and then you're going to switch sides. Now for the calf muscles, what you want to do, you can either use some type of slant wedge, which Brad can show in a second. If you don't have one, you can just go up to a wall, put one foot straight behind you, the other foot straight in front, and then lean forward, and you're going to feel a stretch in the back calf muscles there. Again, 2 to 3 sets of 30-second holds and switch sides. If you want to try and get the soleus a little bit more, which is the other calf muscle, you have to bend your back knee and you'll feel a different stretch.
All right, Mike, I do want to encourage the viewers to actually look at some of the comments. Some people are just making comments about things that they did do or did not do that made their knee much better. One of them, I don't remember the name and it's gone, but she actually used McConnell taping and she said it saved, I believe it was, she saved her knee pain much better. So see what other people have done as well. We can't read all of them because it's just too much. This is a lifesaver for me as far as calf stretching, those muscles back here. I really like this. I actually built this one. I built a few of them and give them away for presents, actually. Put your foot on there, and it's all body weight. Much easier than the going off the edge of the steps or the wall stretch, in my opinion. Much more comfortable. And then you can bend the knee for soleus, straighten it for calf, bend over a little bit of hamstring in there. They're very nice. We do have video on how to make this and some specifics on dimensions. That would be under Bob and Brad Video YouTube.
Andrea kind of had a long question here, but basically she had a sprained MCL, was doing a bunch of stretches. It's doing good, and it had a setback, kinesio taping. She has an ultrasound unit. I don't know if an ultrasound unit can get deep enough to the MCL.
No, the MCL is superficial.
Well, yeah, but I
Medial.
mean, can the unit? I suppose it can get in there. You could try it.
It's not like going into the ACL or the PCL.
Yeah, because they're really in depth.
Yeah, and whatever. That's. I mean, she has it. I don't think it's going to hurt anything. As long as she.
Yeah, just
turn it up too high.
Strengthening the leg, obviously, the quads, the hamstrings, and the hip muscles, making sure you have flexibility like sounds like you're doing already is good. Unfortunately, there's nothing to really speed it up. Just take it slow and don't do too much too soon with the MCL sprain. So do you want to start talking about all the ligaments in the knee?
Yeah, we can do that.
And I'll look through some more questions.
Yeah, because a lot of people are very concerned about if they have knee pain and from a trauma, maybe they fell ice skating, walking down the steps, or whatever the case may be, playing backyard football. The ligaments, we mentioned them earlier, but we'll show you them here. There are 4. And everyone, the most commonly injured ligament is the ACL, anterior cruciate ligament, which is nothing more than this one right here. Then there's a posterior one, which is on the back side. The ACL prevents the tibia from moving forward like this. So it stabilizes the tibia from going that way. PCL stabilizes it from going this direction. Then the MCL, the side one here, and the LCL, they stabilize the humor, not the humerus, but the tibia from going this way and this way. So they're just big, heavy, strong tissues that stabilize the knee, keep it in place. And then the muscles provide an awful lot of stability as well. So if you happen to have an ACL injury, to test it, we've got videos on how it's tested. For the layperson to be able to physically test their ACL or MCL, can do it maybe. It's kind of hard sometimes for professionals or even orthopedic surgeons to test with manual. They always say we need to get an MRI to verify, because you can see typically through the MRI, you can see the tendon or the ligament. If it's partially tore, particularly if it's a full tear, it'll be more obvious. So if you got pain and your knee feels like wobbly after you fell, you may have a torn ligament. And these are probably the best thing you're going to do is get a pair of crutches if it walks and it feels really wobbly and pain, and start walking and protect it. Get yourself to a doctor and confirm what the injury is. If it's that unstable feeling, that because you don't want to wreck another ligament as a result of one injured already.
Yeah, if you have a full tear, most people are pretty aware. They can be loud. You hear a large pop and a lot of swelling. That's more in the sports realm. So if you have a sports injury, the common person, they might just, oftentimes it's like a fall. Like they miss a step or they're going off the curb or trip or something, or their dog trips them. And like, it's just that force of falling down that causes it. And oftentimes if you have a ligament issue, most people also wreck part of their meniscus. Not always, but it's pretty common to have numerous ligaments and the meniscus injured at the same time.
Car injury where you go forward and kneecaps hit the dashboard, that's a really good one to help, or to injure the PCL, the posterior one. Again, when things are swelling up after one of those injuries, you get yourself in a comfortable position, like on a couch. Can you lie up there? Let's just talk briefly about comfortable positioning for a sore knee where it hurts everything to walk. You're not doing too much. Get a pillow and put it under this way, or lift up, or this way, maybe two pillows, whatever feels most comfortable. Get your friend the cold pack on. Don't put a cold pack directly on your skin. Take the pillowcase off and put that on, or a towel is a nice thing. Put that.
If you have some thick pajama pants on or something.
Yeah, right. Like if I'm wearing these, this is all we need. Because if you have a real cold pack, it's going to be below 32 degrees. You put that directly on your skin, it's possible you get some superficial frostbite. So we don't want to compound injuries. All right.
Do you have an exercise for chondromalacia patella?
You're asking me?
There's a question that just came up on YouTube. I'm reading it.
That's one of those diagnoses where I cannot give an exercise without being there and having some face to see what range of motion hurts and what doesn't. Some more specifics over the internet like this. I don't feel confident in saying this exercise or that. So unfortunately, I can't give you any help with that. Sorry about that.
The cortisone injections really help with bone on bone. I've got hyaline injections. Hyaluronic, I can't say the word. With most injections in knees, it depends. I've had some patients that it works wonders, and I've had some patients where they doesn't do anything. So it's really individual. I'm not saying don't try it. You could certainly try it and just see if it helps. Most of the time, if you're recouping from something that's not super severe, it can kind of help take pain off it as you strengthen the knee up and it starts to do better. If it's like osteoarthritis and it's just going to keep getting worse and worse, it may help for a while, but it's kind of like a Band-Aid, I would say.
Yeah, my mother had knee pain, and it was long-term. She had one knee replaced, and then her other one was bothering her. We went in, and the doctor said, we can try a shot of cortisone and then see what happens. And it worked absolutely wonderful. She didn't have to have any further injections for, actually, until she passed away a few years later. So it does work. The thing is with therapists, we typically only see the knee pain with the cortisone if it does not work, because then they say, go see the therapist if the shot doesn't work. So we're a little skewed just from our history. We always see the ones that don't work typically. But yeah, give it a try. Talk to your orthopedic surgeon. And, if you don't like what one surgeon gives you advice on, you can get a second opinion, because they do vary on their opinion, depending on which studies and what their experience is.
Pamela had a question about, she has knee pain going downstairs, and when she squats, I feel the pain in the middle of the knee, but then it goes away as I do more stairs or squats. Same knee, the back side hurts when down on knees to sit. So it sounds like you're having, well, it says middle of knee. I'm not sure if that's the front, but the other one, we didn't address the popliteus and how to self-massage it yet.
Yeah. To decipher that in my head to give her confident advice for me is kind of difficult, because there's a lot of things going on there, and without seeing and getting some direct feedback with the person in front of me, I don't know. But the popliteus, you have pain in the back of the knee. This is really easy to treat if it if the popliteus is tight and you get it to loosen up with this simple massage, it's a good thing. And there's really no downside to it. It's not going to hurt anything. So again, the popliteus is a little muscle here. We're going to get there with our fingers and we're going to work a deep massage. In other words, you're not just moving the skin. You want to get pressure in and massage it for about 2 to 3 minutes. If for some reason it's really painful or you have a cyst there or something of that nature, you need to go in and have it checked out. But if it's a tight muscle, it'll be sore at first, but within 15 to 30 seconds, that should start to relax and feel better. And if that is indeed the case, you keep working it for another minute and then leave it alone and get up and walk again and see what the symptoms are. If it feels better, overall feels like, oh, that really loosened it up, you're right on the money, and continue to treat it that way once or twice a day.
It sounds like when you sit on your knees, hurt when down on knees to sit. That sounds like to me when you're flexing, which could be either that muscle like we talked about, or it can be your meniscus just starting to wear out on the backside within your joint itself. It's slowly, oftentimes you don't feel it when you're non-weight bearing, but it sounds like weight bearing, like squats. And I'm imagining you're sitting on your knees like this is when you feel it. So that could be your meniscus starting to just wear down, or your cartilage in there. You can try a technique where you take a towel sometimes just to warm it up a little bit, put it in your knee there, and then work on just flexing it, because this can open up the joint a little bit more, and just kind of priming it. Or if you're doing squats or anything, maybe hold on to support initially, and then oftentimes it feels better because you're getting some blood flow and circulation in the area. So those are fine to do, but maybe just warm up holding on to something, or just doing air squats if you're using weights. I'm not sure what she's doing, but
right. I want to get into that relates to this as well. A stiff knee, which can be as a result of arthritis, or just tight muscles. But the big thing is to get the knee moving, get that stiffness out, and like what Mike just said, I like doing it in a chair myself. So if I'm seated in a chair, particularly with armrest, but anything will work depending on your mobility, is check out your knee. Can it fully straighten? And then check it to the other one. Let's say this knee fully extends all the way down. It looks straight. And then this one is like 1 inch different. Well, that one you're going to want to stretch a little bit above the kneecap. Put your hands here and gently give it some pressure and stretch it. You know, if you're just feeling some stretch pain, that's good. For some reason, if it's creating sharp pain, you need to back off on it. There may be something else going on, but you're going to work that on a daily basis and eventually get it to being straight again. And check flexion. So this is extension, getting it straight. And the way I like to do a flexion in a chair for someone that just has a stiff knee, there's no real injury that we know of, we just go like this and pull it up like this and compare one leg. Say this one goes all the way up to here. This one, oh, there's a big gap here. It's not on the other side. You may work with that, just repetitive motion. This actually works good lying on your back, so you don't, it's just a little easier, more relaxed. And then, like Mike said, use this towel roll where you put it in here, and that distracts the joint a little bit, and that can help break some of that tightness up. There may be some scar tissue from a previous injury. Yeah, there we go. It feels better even on a healthy knee.
Yeah, Andrea says if you straighten your glutes, does that help with knee pain? I'm guessing you mean strengthen. Strengthening your glutes can help with knee pain, yes, because oftentimes people aren't engaging their glutes enough. Boy, I combined words there. When they are walking or standing or doing simple activities. So this is going to make the knee, the quads, and the hamstrings work a lot more. So strengthening the glute is a good option when it comes to knee pain. A lot of it, like we talked about earlier, you could just rewind the video, but look at your walking pattern, because again, if you are walking with your foot way out in front of you, you are not engaging your glute max at all. You are just engaging a lot of your hamstring and quad muscles. So what you want to do is just walk with a nice soft knee like that. This is going to engage your glutes a lot more and take pressure off of your knee joint itself and your other joints. But your butt muscle can handle a lot. It's a very firm, thick, dense muscle that's strong. It can handle a lot of weight. So Brad, you want to show an exercise they can do?
Let's go to we got Sam in the way. Back off, big guy. Back off. There you go. go up to something solid, cupboard, chair, whatever. We're going to get that glute muscle to fire. That also does a little extend or posterior mobilization of the joint and the knee. We get a little external rotation of the femur. All those things can be helpful. Bend the knee at 90 degrees, about here. That's not real particular, but about there. And then you're going to lift up to here and then go back down to here. I'm not coming up to the table. I'm not kicking really up high. It's a mid-range motion, very comfortable. And that's making the glute work all by itself. If you want to check to see if your glute work, just put your hand on it there. And I can feel the muscles, the fibers contract. If I rotate my foot this direction, so it's kind of towards my other thigh or my other hamstring, that helps isolate that glute even more. So you'll do this for about 30 seconds. And
You don't have to go sideways, weird, funny dance like Brad is. He's just talking to the camera, but
what?
You were turning all weird.
Well, yeah, I would be doing it like this, but I gotta talk to the camera.
Some people were asking for exercises. There's a lot of different knee strengthening exercises, and a lot of it depends upon your skill level, age, and what motion you have. So if you just go to bobandbrad.com, Bob and Brad on YouTube, and search knee strengthening, you'll find a whole array of videos, and you can put in specifically for seniors, for athletes, for whatever your problem may be, or you can put in knee pain or your condition, whatever it is. If you know what it is, then you can just search Bob and Brad that condition, and there's tons of videos with different options in each one. That's stuff you can try.
Yeah, I would say for sure the glute. You can't go wrong with strengthening your glute, even if it's, because it helps your back, it helps the knee, it's part of the pelvis to stabilize that. But the hamstrings are one thing that need to be flexible. So stretching the hamstrings to help the knee, as well as strengthening them. Look at those videos as well. It's going to be very helpful. Again, that's a muscle that oftentimes gets neglected by the average person who's not into having a personal trainer or coach teaching you how to do these things.
Did have a couple questions about like some pool exercises that could work for knee pain. That's perfectly fine as long as you're not like post-surgery, because you can't really submerge your knee post-surgery right away till it heals up a little bit. But other than that, you're fine, especially for arthritis. Anything you do otherwise, any standing hip exercises you can do in the pool. You can do hold on to a wall and just do little flutter kicks. You can walk around. I have people do sideways, backwards, different walking patterns in there. If they're younger, obviously, maybe they can run in place or jog in the pool as well. But just doing anything you do on land.
You've got an underwater treadmill?
We do at my other job. Yeah, they do.
They got that.
You could also just walk little laps around the pool if you don't have one of those. But
yeah, there are some pools that have the current.
Yes.
I'm really big on water therapy. I think it's one of the best exercises you can do, particularly if you have arthritis. The biggest problem is most people don't have access to a pool, and some people just don't feel comfortable in the water. And those two things take quite a chunk of the population out of it.
Yeah, and most of the time, if you go to classes at your local gym with a pool, most of them are fine. Obviously go to a class tailored towards your age group, because they do offer a variety, but those are all fine things. But so I think all in all, you want to work on stretching and strengthening all your leg muscles because they all connect. So anything from your calf to your hamstrings, quads, any of your hip muscles, it all relates to your knee. So you want to make sure you have good motion and good strength through all of it to help with whatever pain you're having. Obviously, if you're at a point with bad arthritis, do what you can. You don't want to overdo it. You will kind of know. I've seen some of the comments say, I'm perfect some days, and other days it feels like I can barely do anything. So just take it easy and do what you can tolerate each day.
Right. For sure. If you're having a bad day on one side, don't be afraid to, have a cane handy and walk with it. If the left knees are painful and the cane goes on the right side, we have videos on proper walking with a cane, but that can make a 10/10 pain with weight bearing drop down to 50% of that just by using a cane. Only use it while the pain is there. When you use a cane, the flare up will go away faster, and then you can get rid of the pain. Get some those people. I think water exercises could really be helpful.
Hey, Bob.
Oh,
Bob
fell asleep.
Do you want to say hello? No, he was writing. He was busy.
Oh, a little extra.
People always wonder where Bob is. So there's Bob. He's here. He's directing from home.
Show the TikTokers.
I'm showing the TikTokers.
Wow. Well, we are running out of time. We've had some really good questions. I hope the information we gave, I mean, you could go on for days with knee pain and other diagnoses, but we've only got 60 minutes. I think we're past 60 minutes.
Is that what we're calling the show now? 60 minutes?
No, I'm afraid not.
That's
no.
taken, maybe. Well, thanks for watching. We'll be back next week to talk about osteoarthritis in numerous joints, not just the knee.
There you go. So once again, Bob, I, and Mike are working on fixing anything except for
a broken heart.
But we're going to work on that as well. I got a little project in the garage back home. I'm going to get some welder out, going to get 2 pieces of steel shaped like a heart, weld it right down the center, and it'll be fixed.
I don't think our hearts are
I
made
think
out
that'll
of
work.
steel, but okay.
Yeah, it'll work fine.
Yeah, Tin Man over
Take
there.
care.